Hi, welcome to my very special Bug of the Day video presentation about Bartonella henselea, and I would like to welcome my very special guest, my cat, who does not like the hat I made her. However, she looks very cute in it. And we're going to talk about how she could get me sick. So, Bartonella henselea, what is it? It is a very small bacteria that can live inside cats, fleas, and also you. It breathes oxygen just like us, so it has to have access to somewhere where it can breathe. And this bacteria is about 2 micrometers long, meaning that you would need 12,700 of these lined up end to end to get an inch. So these are very small bacteria, and another interesting thing about them is they look a little bit like this. It's a rough sketch, but they have little extremities basically on the outside where they can twitch on hard surfaces to get around. They can't swim, but they can twitch back and forth, have some sort of movement. So now, how is my cat going to get me sick? She often likes to scratch and bite because she is quite feisty. And so Bartonella henselea is spread through cat scratches as well as fleas and cats licking open wounds. So basically it can be spread either through the scratch where flea poop, which has this bacteria, gets into your blood. And it is more commonly transmitted by kittens and stray cats. Now, how do your cats get it? Or any cats get it? This is spread mainly through fleas and also fights with other cats. So the fleas will bite the cats who have Bartonella henselea, and this bacteria will basically grow in their gut. It'll raise a little bacteria family, and then the flea will poop out that entire family, and it can go live other places, either on a cat, or it can get in open wounds, get into you, get into cats. That's basically how it's being spread. And so, yeah, when other cats will fight, they'll have open wounds, and this has a risk of getting infected with this bacteria. Now, what is this going to do to you or me when my cat inevitably scratches me and infects me with this? Well, it is commonly presented by a low-grade fever, swelling of your lymph nodes, and also some generalized aches, headaches, muscle pains. And then finally, there's often a pustule at the site of the scratch, meaning you'll look at it and it didn't heal like a normal cat scratch. It is now pussy, red, and pretty gross. So that is for mild cases, which normally resolve on their own. But for people who are immunocompromised, there are often more severe cases. Well, there are sometimes more severe cases, which can have bacterial infection of your heart called endocarditis. You can get pneumonia and a high-grade fever, and there are reports of symptoms like anorexia, which is extreme weight loss and loss of appetite, as well as some cases of seizures, which are linked to Bartonella henselea. Okay, now how is it treated and prevented? It is uncomplicated cases often resolve on their own. So if you have the low-grade fever, it might go away pretty easily by itself without intervention. But for complicated cases, it's often prescribed different antibiotics to help kill this little bacteria which is causing your disease. And a lot of the importance of Bartonella henselea is prevention. So medicating the cats, if you have outdoor cats, medicating them with flea prevention is very important, as that's one of the major vectors of this disease, as well as keeping cats indoors and away from other cats will prevent them getting this disease more effectively, as well as if you get scratched or bitten by a stray cat, make sure you wash that wound with soap and water. And yeah, avoiding interacting with or getting bit or scratched or licked by stray cats, especially kittens. And finally, I think it's pretty interesting that cats are the main reservoir. I don't know why. I just picked this bacteria because I found a way to incorporate my cat and make her a little hat today. So thank you so much for watching.